Hey everyone, welcome to our deep dive. Today we're going to be looking at something pretty incredible.
Yeah, childbirth.
Oh yeah, right. Childbirth from the EMT's perspective,
Exactly.
using their training manual
Yeah.
as our source material today.
Yeah.
So are you ready to see what it takes to bring new life into the world?
I think it's going to be fascinating to see what these EMTs encounter on a daily basis and, the kinds of skills they need to handle these really intense situations.
Well, let's jump right into it then. Um, one thing that really struck me when I was looking through this textbook was just how much emphasis they place on effective communication.
Hmm.
Why is that so important in the context of childbirth?
Well, think about it. You've got a patient who's in pain, probably anxious, and, on top of that, there's a whole new human about to enter the world.
Right.
So clear communication helps the EMTs build trust with the mother, get those vital pieces of information, and, even coordinate with other medical personnel who might be arriving on the scene. It's all about creating a calm environment amidst, what can be a really chaotic situation.
Okay, so let's put that into practice, shall we? Let's meet our first mom-to-be, Natasha, a 22-year-old woman experiencing her second pregnancy.
Okay.
She's in rapid labor, and things are progressing quickly.
Got it. So the textbook points out that Natasha's heart rate is elevated 168 beats per minute. That's not unusual during labor, but it is something that EMTs monitor closely.
Right.
And here's where it gets interesting. The baby's head is already visible.
Oh, wow.
This delivery is happening N-now-W.
Talk about a home birth with a sense of urgency.
Mm-hmm.
What steps do the EMTs need to take when a delivery is imminent like this? They don't have much time.
No, they have to act quickly. The textbook really emphasizes the importance of supporting the baby's head, making sure the umbilical cord isn't wrapped around the neck. And, they might need to suction the baby's airway if necessary, constantly monitoring both the mother and baby for any signs of distress.
Wow, that's incredible. Okay, let's shift gears a little bit. Our next case involves a bit of a curveball. It's a breech birth. This time we've got a baby girl named Ashley who's decided to make her entrance feet first.
Wow. Okay, so breech births definitely add a layer of complexity. The textbook actually provides a really helpful visual here.
Oh, does it?
It does. It shows the baby's feet protruding first instead of the head. Really drives home the point that, EMTs need to be prepared for anything.
And I was thinking, I can imagine that this changes their entire approach to the delivery.
Oh, absolutely.
Yeah.
Instead of, focusing on supporting the head, they need to carefully guide the baby out, make sure that the umbilical cord isn't compressed.
Right.
And they might even need to reposition the mother, which is so crucial for safe delivery.
Oh, wow. Yeah.
But you can imagine that that's pretty tricky in a situation like this.
Yeah, for sure. And the textbook also mentions increased anxiety in the mother during a breech birth. I mean, understandably so, right?
Absolutely. Think about it. You're expecting a certain kind of delivery,
Yeah.
and then suddenly things are completely different. It's got to be terrifying.
For sure. It sounds like emotional support in a situation like this is just as important as, the actual physical actions that they're taking.
Oh, 100%.
Yeah.
The EMTs really need to project a sense of calm and confidence, even if they might be feeling a little bit of pressure themselves.
Yeah, okay, so for our final case today, things take a much more serious turn. We meet Marie-Louise, a 35-year-old woman who's experiencing sharp abdominal pain, vaginal bleeding, and low blood pressure.
Oh, that's concerning. Those are all classic signs of abruptio placentae, a condition where the placenta separates from the uterine wall prematurely.
Wow. Okay, and how serious is that?
It's life-threatening. Imagine this, the placenta is the lifeline between the mother and baby.
Right.
And it's being severed. So this is a true medical emergency.
So every second counts.
Absolutely. The textbook really emphasizes the need for rapid transport to a hospital. And the EMTs need to be very vigilant in monitoring those vital signs throughout transport.
Wow. Okay, so I'm curious. The textbook briefly mentions these mnemonics, gravida and para, that EMTs use.
Oh, yeah.
What are those all about?
They're really useful tools that help EMTs quickly gather and assess a pregnant woman's history, which is crucial in understanding, potential risks and complications.
Oh, okay. So it's like a shortcut to crucial information.
Exactly.
Okay, so break it down for us. How do they actually work?
Okay, so gravida refers to the number of times a woman has been pregnant,
Okay.
regardless of the outcome. So if a woman has been pregnant 3 times, she's considered gravida 3, whether those pregnancies resulted in live births, miscarriages, or abortions.
Okay, so Gravita gives us like a broad view
Yes.
of her entire pregnancy history.
Exactly. And that's where Paravia comes in. This one provides more specifics about the outcomes of those pregnancies.
Okay.
It stands for the number of births a woman has had. It's further broken down into full-term births, premature births, abortions, and living children.
Wow. It's like a mini history of her births.
It is. It's a very concise way of communicating all that information.
Wow, that's incredible.
Yeah.
Okay, so let's recap for a second. We've got 3 very different cases here. We've got a seemingly routine delivery that became urgent, a breech birth that required some special techniques, and then a really life-threatening situation with the abruptio placentae.
It's a really good snapshot of the diverse challenges that EMTs face in the field of obstetrics. Each situation demands quick thinking and decisive action.
Yeah, it really makes you appreciate the depth of knowledge and skill they need to have.
Absolutely.
Just reading through those test your knowledge sections in the textbook.
Yeah,
It's a lot to take in.
it is.
But before we move on to those key takeaways, is there anything that stood out to you so far? Anything that's really surprised you?
What's interesting to me is that while these cases highlight all these potential complications, most births are actually joyful and natural events.
Right.
So I think this knowledge shouldn't create fear, but rather empower us
Right.
to understand those complexities and be prepared to act if needed.
Yeah, knowledge is power.
Right.
Okay, well, speaking of knowledge, let's unpack some more of those key takeaways in the next part of our deep dive.
Welcome back to our deep dive into the world of obstetrics.
I was thinking about that question you posed at the end of the last part, and it's really sticking with me. It's one thing to read about these emergencies, but it's quite another to imagine ourselves actually facing them.
It really puts things into perspective, doesn't it?
It does. But before we jump back into the thick of things, what were some of those key takeaways from the cases we discussed in the last part that really resonated with you?
Well, for me, it's got to be the importance of rapid assessment. In each scenario, the EMTs had to make those split-second decisions.
Yeah.
Gather crucial information about the mother, the stage of labor, any potential complications, and it all had to happen so quickly.
And based on that assessment, they have to figure out the next steps.
Exactly.
Right.
Do they need to transport her immediately? Can they deliver the baby safely right there?
Yeah.
It's a lot of pressure.
It is, and I think that's where those mnemonics we talked about come in handy, right?
Oh, absolutely. Gravita and Para, they provide that concise snapshot of the patient's history, which can be crucial in those first few moments.
Okay, so let's revisit those then. Remind us again how Gravita works.
Sure. So Gravita tells us the total number of pregnancies a woman has had,
Right.
regardless of the outcome. So whether it's a live birth, a miscarriage, or even an abortion, each pregnancy counts towards that number.
Okay, so if a woman has been pregnant 4 times,
Mhm.
she'd be considered Gravita 4, even if only one of those pregnancies resulted in a live birth.
Exactly. It gives us that full picture of her pregnancy history. And then we have Para,
Right. Para?
which is all about the out things of those pregnancies.
Okay.
So it stands for the number of births, and it's broken down even further. We've got full-term births, premature births, abortions, and living children.
Wow, so it's like a mini medical history.
It is. It's like a secret code that unlocks all this important information.
So if a woman has had 2 full-term births, 1 premature birth, and 1 abortion, her PRA would be 2113, with the 3 representing her 3 living children.
Exactly. You got it.
Okay, that's fascinating. I'm starting to see how valuable these acronyms can be in a high-pressure situation.
Oh, they're essential. They help EMTs assess risk factors and
Yeah.
potential complications more effectively.
Yeah, that makes sense. So we've talked about rapid assessment, those handy mnemonics. What about the APGAR score? The textbook mentioned it briefly.
Oh, yeah, the APGAR score. That's a fantastic tool for quickly assessing a newborn's health right after they're born.
Okay, but refresh my memory on how it actually works.
Sure. So it's based on 5 key categories: appearance, pulse, grimace, activity, and respiration. Hence the acronym APGR.
Oh, right. I get it now.
Each category is scored from 0 to 2, with 2 being the best possible score.
So the higher the score, the better the baby is doing.
Exactly. A perfect APGAR score is a 10. But anything above a 7 is generally considered healthy.
Okay, but what if the score is low? What does that mean?
Well, a low score, especially in those first few minutes after birth, can indicate that the baby needs some extra help.
Oh.
Maybe they need oxygen or suctioning. It's a crucial piece of information that guides their immediate care.
So it's like a quick snapshot of the newborn's health.
It is. It's incredible how much those 5 simple observations can tell us.
So we've got rapid assessment, mnemonics, the APGAR score.
Yeah.
What other challenges do you think EMTs face out there in the field when responding to these obstetric emergencies?
Well, one of the biggest challenges is the environment. They're rarely working in a sterile, controlled hospital setting.
Right.
They might be in a patient's home, on the side of a road, even in the back of a moving ambulance.
Oh, wow. Yeah, that adds a whole other layer of difficulty.
It does, and they often have limited resources and personnel available.
So they really have to think on their feet.
Oh, absolutely. They need to be resourceful, quick thinking, and adaptable.
It's like being a medical MacGyver.
Right. But let's not forget about the emotional side of things. These EMTs are dealing with patients who are going through one of the most intense, life-changing events imaginable.
And sometimes those events don't go according to plan.
Exactly. So
Yeah.
they're encountering a lot of fear, anxiety, sometimes even panic.
It sounds like they need to have strong emotional intelligence as well as medical expertise.
Oh, for sure. They need to be able to provide reassurance and support,
Right.
maintain clear communication, and, stay focused on the medical tasks at hand, all while managing their own emotions and stress.
Yeah, that takes a special kind of person. And the textbook mentions that continuous learning is so crucial in this field.
No, it's essential. Obstetrics is constantly evolving, new research, new techniques.
Right.
EMTs need to stay updated on the latest best practices and protocols if they're going to provide the best possible care.
So they're lifelong learners then.
Absolutely, they're always striving to improve their skills and knowledge.
It's inspiring to see that level of dedication. It really underscores their commitment to the well-being of both mothers and babies.
For sure.
We've covered a lot of ground here, but I want to make sure we highlight that one key takeaway for our listeners. What's the one thing you really want them to remember from this deep dive?
While we've discussed all these potential complications that can arise during childbirth, it's really important to remember that most births are joyful and natural events.
Right.
But having this knowledge, understanding those complexities, knowing there are skilled professionals who are trained to respond, it's empowering. It allows us to appreciate the miracle of birth even more.
Yeah, and recognize those incredible individuals who dedicate their lives to making sure it happens safely.
Exactly.
So before we wrap things up, what's been the most surprising or intriguing thing for you throughout this exploration of obstetrics?
What really struck me is just how much EMTs need to know and how quickly they need to apply that knowledge in those high-pressure situations. They're truly on the front lines of healthcare. They're making life or death decisions in the blink of an eye.
It's remarkable, isn't it?
It is. And I think it speaks to their skill, their dedication, and their resilience.
I agree. Well, we have time for one final thought before we conclude this part of our deep dive.
Okay.
What's something you want our listeners to ponder as they move forward with this new knowledge?
Okay. I want you to imagine yourself in the shoes of an EMT. You get a call about an obstetric emergency. The adrenaline's pumping. You arrive at the scene. Maybe it's a home birth. Maybe it's a car on the side of the road.
Right.
You assess the situation. You gather information. And you realize it's a breech birth. Or there are signs of abruptio placenta.
Oh, wow.
How would you react in that moment?
That's a powerful question. It makes you realize that knowledge is one thing, but applying it under pressure like that, well, that's a whole different ballgame.
Absolutely. It's about trusting your training, relying on your instincts, and staying calm amidst all the chaos.
It's about taking everything you've learned
Yeah,
and putting it into action when it matters most.
exactly. And hopefully remembering those mnemonics.
Right. Gravida, para.
Exactly. Well, this deep dive has certainly given us a lot to think about, hasn't it?
It has.
Yeah.
It's given me a whole new appreciation for the challenges and rewards of working as an EMT in the field of obstetrics.
Yeah. And on that note, we'll sign off for now, leaving you with that thought-provoking question to ponder.
Yeah, that's a question that really makes you think.
Yeah.
It's one thing to talk about it,
Yeah.
but to actually imagine yourself in that moment.
Yeah. And I think, it brings up a really important point. Even if we never actually find ourselves, in those shoes,
Right.
having that knowledge, that understanding,
Right.
it gives you a deeper appreciation
Yeah.
for the whole process and the people who are trained to handle it.
Absolutely. This deep dive has been incredible. We've tackled routine deliveries, breech births, the urgency of abruptio placentae. We even learned how to decode those mnemonics, gravida and para, which, to be honest, sounded a bit like a secret code at first.
Yeah, I think it's safe to say we're both fluent in gravida and para now.
Right. And the AFGAR score. Such a simple yet effective system for, quickly assessing a newborn's health.
It really is. It's amazing how much information those 5 categories can tell us.
Yeah. So as we wrap up today, what's one key takeaway you'd like our listeners to remember from this exploration?
Throughout this deep dive, we've focused on the technical aspects, right? The procedures, the complications.
Yeah.
But I think it's important to remember the human element.
Yeah.
Childbirth is such a profound experience. It's filled with joy, anticipation, and sometimes fear.
Right. And, we talked about the mother's anxiety during a breech birth, but can you imagine the emotions that the EMTs are encountering in these situations?
Oh, absolutely. I mean, they're dealing with expectant parents who are excited, nervous, terrified.
Yeah.
And all the while they have to remain calm, reassuring.
Yeah, it's a lot to handle.
It is. They're not just medical professionals,
Mm.
They're also caregivers. They're witnesses to this miracle of birth, but they also see the potential for things to go wrong.
It's true. It makes you realize that their work goes beyond the textbook.
It does.
It requires empathy, compassion, and a deep understanding of, that human experience.
And that's something we can all learn from,
Yeah.
whether we're witnessing the birth of a child, supporting a friend or family member through pregnancy, or simply encountering a pregnant woman, remembering that human connection. It makes all the difference.
It really does. Well, we've gained so much from this deep dive, knowledge, insights, and I think a newfound appreciation for just how complex childbirth can be.
Yeah.
And for the amazing people who work so hard to ensure safe deliveries.
Yeah, and for the strength and resilience of mothers.
Absolutely. So as we sign off today, we want to encourage you to stay curious and keep exploring. Remember, knowledge is power. And, even an event as seemingly routine as childbirth, well, it's full of wonder and challenges and the potential for extraordinary human connection.
And who knows, maybe this deep dive has sparked an interest in learning more about obstetrics. Or maybe you'll just look at childbirth with a newfound sense of awe and respect.
Right. Until next time, thanks for joining us.